Good afternoon. My name is Pat Living. I'm with the Department of Health and Social Services, and I will be your moderator this afternoon for the COVID-19 update for Friday, April 17th. We are joined today by Yukon Premier Sandy Silver and Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Following the presentations, we will go to the phone lines. We will do one round of questions, so you get one question and one follow-up, and then if time permits at the end, we will go back for another round. Thank you. Premier Silver.
Thanks, Pat. Good afternoon, everybody. Thank you again for joining us here on the traditional territory of the Kwanlundun First Nation and the T'Onkwatchin Council. Today I'll share some important updates about government efforts to reduce the spread of COVID-19 in Yukon and how we are supporting Yukoners during this time. Following my remarks, Dr. Hanley will provide an update from his office on the latest numbers and the progress in the fight against the virus. As folks know, it's another beautiful, beautiful day in the territory. We're seeing the classic signs of spring. The Dawson Ice Bridge, for example, is closed. I saw some swans the other day flying overhead, and that definitely warmed my heart. And of course, there's plenty of mud puddles out there for the young at heart and the young to be entertained in. And so it's nice to see spring coming. As the weather improves, we are continuing to see people traveling to Yukon as well, and we're seeing people traveling up for some non-essential purposes. But we've been very clear, that we must restrict non-essential visiting during this state of emergency and this public health emergency to protect ourselves against the risk of further importing COVID-19 to the north and to the Yukon. We have had enforcement officials working at Yukon borders since April the 6th, and despite our strong recommendations for people to stop all non-essential travel to the Yukon, we still see people coming up our highway to the territory. We know that the most important way to keep Yukoners safe is to reduce opportunities for contact with the virus. This is why so many people are making such major sacrifices to stay safe. People are staying home. Businesses have closed or changed how they serve customers. Schools are not meeting in person, and hospitals have reduced non-essential surgeries. We do not want these significant and well-appreciated efforts to be thwarted by recreational visitors bringing the virus to the territory. Due to this continued traffic, we are further restricting Yukon borders to all non-essential and non-critical travelers. As of today, the only people who are permitted to enter the territory are those who have a specific sanctioned reason for being here. That includes Yukoners returning home, non-residents traveling to be with a family member who is a Yukon resident, workers who are identified as critical or essential in Yukon or in the BC-Yukon border area. Also, people who are transitioning through the Yukon, they will continue to be ordered to spend no more than 24 hours transitioning through Yukon. Enforcement officers have the discretion to turn back any non-essential travelers. They will continue to track anyone transitioning through the territory to make sure that there is a record of who has been allowed to enter and what their travel plans are while in the Yukon. Now, we don't make this decision lightly. We value and appreciate people who travel to Yukon as tourists, for example. They support our tourism industry in normal times, and we work extremely hard in normal times to encourage visitors to this territory. And times will change, and we will be again welcoming visitors back here to the Yukon with open arms. If you are considering a trip to Yukon, keep the planning going. There's so much to do and to see here, but now is just not the right time. We know the tremendous impact that this is having on our tourism industry. I can feel the deep sense of loss from the many amazing businesses and employees who welcome visitors each year. These are extremely challenging times. I know that Minister Dendies and Minister Pillay and the teams at Tourism and Culture, Economic Development as well, they're working extremely hard to get supports out to businesses feeling this loss. I also know that a lot of work is being done now to be ready to rebuild our industry as soon as restrictions are lifted, including work being done by the new Yukon Tourism Advisory Board, which is providing Minister Dendies with great advice and recommendations. To help address the impacts of COVID-19 pandemic on Yukon tourism sector, the government has committed a $1 million increase to the Tourism Cooperative Marketing Fund. This will be used to respond to industry's needs when the time is right and it is appropriate to re-enter the marketplace and welcome tourism once again. Again, we need to do that preparation now for the time later. Information on the revised fund is being developed with the Tourism Advisory Board and will be available beginning May the 1st, 2020, and that information will be on yukon.ca. I would like to remind Yukoners that our government is here to help you, and we are working to support you in many ways. Financially, we have supports for businesses through the Business Relief Program. We've committed to getting these applications out by next Monday, and I'm really happy to see that the department team got those applications out this past Wednesday, which is fantastic. They've received more than 300 inquiries and are currently, they are now processing applications. So thank you to the Department of Economic Development for your amazing work. We have also introduced supports to offset the losses due to the canceled events due to COVID-19, eviction protection measures, as well as a paid sick leave program. We have seen considerable support announced by the federal government, and we appreciate how quickly these announcements are being made. That being said, we are pushing our colleagues in Ottawa to provide the details of how this funding will work and when it will be available. We know Yukoners need this support quickly, and we are sending a strong message to the federal government to get this money flowing as soon as possible. I spoke with Prime Minister Justin Trudeau yesterday and shared with him our concerns that we need his ministers to work more closely with our ministers to make sure that any programs released are making the biggest impact possible. This coordination is very important to make sure that no one is left without supports. We are definitely stretching our resources to support as many Yukoners as possible, and we want to make sure the federal programs complement our efforts. For those who are in need of mental supports, mental health supports, there are resources available. These are very challenging times for everyone, and even though we need to keep a safe distance from one another, you're not alone. Support is available for Yukoners during these hard times. I would also like to speak briefly about Yukon's long-term care facilities. Those of you with family in Yukon facilities who are concerned, let me reassure you that your loved ones are being well cared of and they're being kept safe. We have 5 long-term care homes in Yukon, all of which are government run. We are extremely fortunate that nearly all of our long-term care homes have single rooms. This is a significant advantage should we need to contain an outbreak. As always, the Continuing Care Division continues to work in close partnership with Yukon Communicable Disease Center and the Chief Medical Officer of Health's office on infection control practices and outbreak management. We took very early action to protect residents living in long-term care homes because they are some of our most vulnerable citizens. This includes restricting visitors to only essential visitors in all of our long-term care homes. The essential visitors are screened before each visit. Staff are working to keep residents active and engaged, which is extremely important. We are providing a variety of recreational activities and programs and facilitating virtual visits and window visits to support residents and their families. The employees managing these facilities are very committed to the well-being of the residents. Staff are required to stay home if they're feeling sick, and staff movement between facilities is very limited. Extra training is also being provided to staff on correct use of personal protective equipment, following our existing policies and procedures as well. We have established control measures to safeguard and to monitor use of personal protective equipment and to make sure that we have enough available as we continue to manage this situation. And to all those care providers, thank you very much for all of your due diligence, your professionalism, and your service to our elders. I would also like to take a moment to acknowledge the new realities of our territorial education system now that learning has resumed for students across the Yukon. The decision to suspend face-to-face classes will help protect health and safety of our students, of our teachers, of our faculty, of our families, and our communities. We recognize that this is challenging for students and for families across the territory. My message to students is to keep up the good work. It's about your education. We are all in the middle of a real-life learning opportunity. Remember to be patient with yourself and with your family as we all learn how to adjust to this situation together. I know that you are adaptable and will rise to the challenge. To parents and to families across the territory, thank you. Thank you for your patience. Thank you for your understanding. You're not alone when it comes to your child's education. Each school has developed alternative learning opportunities and will be providing individualized learning plans and support for the remainder of the school year. The plans are flexible. The school staff are available to help you adjust. Please do not hesitate to contact your teachers and principals at any time if you need additional support. And to teachers, educational assistants, administrators, thank you very much for all of your hard work to ensure that Yukon students can continue their learning journey this year. As a former teacher myself, I know how hard you work to support each and every student. Your dedication during these extraordinary times is extremely important and extremely very much appreciated. Thank you. Finally, I'd like to once again thank all Yukoners for following the recommendations of the Office of the Chief Medical Officer of Health. The steps that we are taking now are critical to preventing the spread of COVID-19 in the territory. We must continue these efforts, as challenging as they may be, as nice as it is getting outside, so that we can all return to normal sooner rather than later. The limited spread that we have experienced so far here doesn't mean we can be relaxed or become complacent. What it does mean is the extraordinary steps that we are taking are working. We must remain vigilant to protect the health and the safety of our community. Most of all, I want us to all remain hopeful. I know that these measures will end and that we can all come together through this stronger and more united as a community. These are extremely challenging times, as you all know, and but we're pulling together, and we're pulling together by working together. So thank you very much for that. And with that, Dr. Hanley.
Thank you, Premier Silver. I just wanted to make sure my ASL translator had a chance for a quick break. Good afternoon, bonjour, tout le monde. As of today, there is one new case of COVID-19 in the territory, bringing the total number of cases to 9. The new case is in Whitehorse and related to international travel. Case investigation and contact tracing is underway, and the person is doing well at home. 7 of the 9 people, therefore, who have contracted COVID-19 in Yukon have recovered. No one has had to go to a hospital. I'm just going to repeat that in French. À compter d'aujourd'hui, il y a un nouveau cas du COVID-19, donc portant le nombre total de cas à 9. Le nouveau cas est à Whitehorse et est lié à un voyage international. L'enquête sur le cas, la recherche des contacts est maintenant en cours et la personne se porte bien à la maison. 7 sur ces 9 personnes qui ont contacté COVID-19 se sont rétablies et personne n'a dû se rendre à l'hôpital. It seems like quite a while since we've had a new case to add to our list, and somehow it always feels like a violation of our sanctified place in the territories. How could COVID still dare to invade our territory and threaten us? But this is COVID. COVID is a virus that knows no borders. We have always expected to see new cases. We are reassured that the frequency, however, of such introductions has decreased and can take solace that this is the first new case we have seen in over a week. We can also take comfort in knowing that up to now, all of our cases can be traced back to a travel origin. But let me tell you, while we in public health may be used to working in the background, we are never complacent. Outbreak preparedness and control is what we do. And let me thank you for doing your part. This is not easy to do at all. When physical distancing and isolation measures are carried out, it has a huge influence in containing the spread of COVID and making the task of public health follow-up so much easier. I think this case is a timely reminder that even as we join the rest of the country and the world in contemplating the road ahead of us and the possibility of relaxing some of the restrictions currently in place, that the threat of COVID will not go away until our population is immune, either from disease or from vaccine. My goal, to be clear, is the latter and not the former. Many have been asking about testing and how we are changing our testing strategy and why our testing numbers are going down. It's worth pointing out a few key aspects of how we have been doing testing to date. First, although we have targeted testing, we have never had to restrict testing in Yukon because of supply issues. You will see from our numbers, which we will now update daily, that test turnaround time is now very good, with the only remaining bottleneck being the transport time, either within or outside of Yukon to the lab in BC. Second, our testing volume has decreased in recent days due to lower rates of respiratory illness in the community, as well as fewer people traveling into the territory, meaning we have less people exposed to COVID, where COVID is actively circulating, thus less people needing to be tested. We continue to look for COVID through testing people hospitalized with respiratory complaints, as well as liberal testing in rural Yukon and testing according to travel criteria, as well as whenever physicians are concerned about COVID hiding behind symptoms. I know on that subject that everyone is following also with great interest the progress in acquiring point-of-care technology. Over the next few weeks, we will have a GeneXpert rapid test machine up and running in Whitehorse for those situations where a rapid test result can help to contain a potential cluster or outbreak rapidly, or assist in clinical situations where patient care, such as an urgent operation, can occur more safely and efficiently with knowledge of COVID status. As we acquire this machine, we will learn more about this technology's potential role as an additional testing component. Similarly, the much-awaited Spartan Cube machines should allow us for more portable testing capacity in communities over weeks to come. However, how many we will get, when we will get them, exactly where they will be placed, and what role they will play are all still works in progress. But, as always, the bulk of our testing will be through tried and true ways. As always, we continue to enjoy the excellent relationship with BC CDC Lab for high testing quality and rapid turnaround of tests. The recent case reminds us that we cannot declare Yukon a COVID-free zone, but our goal remains the same: to delay, diminish, or even to deflect completely community spread in Yukon. Even as we contemplate summer activities, increasing access to health care, and taking a critical look at what services could be continued or restored, all must rest on the fundamental 6 principles of staying safe: physical distancing, regular hand washing, staying home when sick, not gathering in groups of 10 or more, avoiding travel to communities, and self-isolating when required. And what will it take to get us back to normal? Firstly, a long time yet, and we should be setting vaccine availability as our ultimate target for complete relaxation. But within an environment of strict border control and all the measures above, it is possible to look at where we can open up to a safe and comfortable degree. The World Health Organization has identified 6 criteria for how that should happen in what the WHO refers to as transition to, and what we might call maintaining a steady state of low level or no transmission. These measures are that COVID transmission is controlled to a level of sporadic cases or clusters of cases, that we have sufficient public health and health system capacity in place, that we have outbreak risks minimized in high vulnerability settings, such as long-term care, that workplace preventive measures are established, that the risk of imported cases is managed through border measures, and finally, that communities are fully engaged. This is a theme I'm only introducing at the moment. We still have lots to prepare, and our preparations could be delayed or thwarted by a large outbreak. But this is a topic we, along with the rest of the country, will be actively pursuing. Meanwhile, let's do it again like we did last weekend. We have the stunning outdoors at our doorsteps and the sun at the ready. Let's use it wisely and use it well. Thank you. Merci. Merci, Joe.
Thank you, Premier Silver. Dr. Hanley. We'll now go to the phone lines. The first up is Marin at Aurore Boreal.
Hello. This is a question for Minister van Silver. So you mentioned that there's many people coming from out of territory and that there is exception for essential workers on the reinforcement of the borders. Would you consider that people that come for edible wild plants like mushrooms are considered like essential workers because it is the season coming very soon? Are we going to allow those people to come in?
Quite simply, no. I would not consider that essential.
Okay, that was it. Thank you.
Do you have a follow-up, Marin?
No, thank you.
Okay, we'll move to Claudiane, Radio-Canada.
Yes, hi, sorry, I needed to find the button. I am unsure, Premier, how different this new announcement about the border is. The recommendation was always non-essential travelers, and a lot of people are concerned still mostly by people traveling through on their way to Alaska as being the main sort of non-essential traveling. So I'm just curious as to what is different today than what was already in place.
Thanks, Claude. I think the main difference now is the authority to turn people back. You know, if you've been watching how we've been unrolling the Civil Emergency Measures Act, we start with, well, even before that with the medical emergency, we start with recommendations, and every week what you're seeing is a clamping down, more restrictive, moving from recommendations to mandatory actions. And what you see right now is a solidification of that final step of we mean business, and if you are showing up and it's not essential, and if you're here trying to escape somewhere else or just coming up for traveling, for tourism reasons, that we now have the authority to stop people either down south or at the border and say no and turn them around there. I think the big question here about, you know, it's interesting that we're doing it now. You know, today more than ever, as I'm looking at the streets in Whitehorse, traffic has picked up. You know, there's more people moving around, and we want to make sure that the message is extremely clear that even though the weather is getting nice, it's now time more than ever to continue to self-isolate, to continue to do all of the things that you're supposed to do as Yukoners, but also that folks that were thinking that maybe now is a time that they could turn to the Yukon, now is absolutely not a time. And if you're not coming up for essential services, this next measure, this next step is again, so that we can avoid that widespread community transmission that we're trying to avoid, we must continue to fight hard against such a possibility. And so that's why we are, saying now we will be turning you away at the border if necessary.
A follow-up, Claudiane?
Okay. Maintenant, yes, for Dr. Brendan Hanley, en français, c'est possible de me répéter, de me dire pour les besoins de la radio. Donc, vous allez vous munir d'un équipement de test de dépistage rapide. Est-ce que c'est par constatant? Peut-être juste expliquer pourquoi vous équipez de cette machine-là.
Donc, juste pour être clair, c'est les raisons pour avoir un test diagnostique rapide?
Oui.
Oui, on attend donc, on peut peut-être dire 2/3 de machines pour faire des dépistages rapides. Just to reiterate in English briefly, this is about the reasons for rapid diagnostic testing. Donc, il y a, malgré qu'on a une relation très efficace et très bonne, on a priorité pour tous les cas du Yukon pour être au premier rang pour avoir les tests contrôle de maladie à Colombie-Britannique. On a quand même besoin de temps en temps pour avoir un résultat plus rapide. Donc, il y a des cas donc, à l'hôpital, par exemple, si en attendant une opération, quelqu'un a des symptômes et on veut clarifier si COVID est présent ou non, ou s'il y a une situation d'éclosion dans une facilité où on veut vraiment encercler la possibilité de personnes exposées. Donc, on veut avoir les résultats des cas plus rapidement. Donc, c'est pour certains cas où c'est vraiment un avantage d'avoir des résultats immédiats ou dans quelques heures, et au lieu d'attendre 2-3 jours pour un résultat. Donc, je peux peut-être continuer avec la deuxième tiers, c'est la Spartan Bio. Et ça, c'est un autre niveau qui est un test rapide qui on peut placer dans les communautés. Et, mais c'est toujours une question, on est toujours en train de converser avec le gouvernement fédéral pour clarifier combien de machines on peut avoir et quelles sont les qualités de test. Donc, est-ce que c'est bien placé, par exemple, pour avoir dans les centres de communauté? Et si oui, dans combien? Si on a 3 ou 4, par exemple, ou si on a 6 ou 7, on peut déplacer stratégiquement selon la capacité de test et selon le nombre qu'on va avoir. Donc, c'est toujours les conversations en progrès.
We'll go now to Gabrielle, Whitehorse Star.
Hi, a question for Dr. Hanley. Earlier this month, you said that the Yukon wasn't capable of conducting tests here. I'm hoping you can explain how the GenExpert machine will change that, if it does, if that's my understanding.
Yeah, so there are different types of testing capacity. So this adds to our current testing capacity, but it does not replace the testing that we have, and it will never replace the testing that we have with the outside testing at the BC Centers for Disease Control Laboratory. And that's because of the The type of test is it's a different technology. So the technology that we will get with the Gene Expert machine will be a rapid turnaround, but will likely have different qualities. And it relates to how many tests could be done. So the volume of tests is likely to be lower. Also, the accuracy of the test may not be the same as the kind of the gold standard test that is done at the major center, the tertiary care centers and the tertiary labs, including BC-CDC. So that's why I say it won't replace the standard test, but it will have a kind of a niche role for certain situations where even if we have a different level of accuracy, we can work with that, develop criteria for testing, priority reasons for testing, and work with that as a kind of a supplemental test. But almost certainly we will need confirmatory testing still to be carried out. So probably more to explain as we learn more about the technology, as we learn more about the test characteristics, and as we get closer to actually acquiring the machine. I will say though, although we will likely acquire the machine in the very near future, it will likely take several weeks before all is set up because of the training that has to go with it, the just getting it set up, the quality assurance, and all that has to go into making it as reliable a test as possible.
Follow-up, Gabrielle?
Yes, my other question was, as far as those 6 criteria by the World Health Organization goes, at face value, it looks like we meet those criteria now. Is that true, and are there other Yukon-specific criteria that we need to meet before we can really have that conversation?
Yeah, so the WHO 6 criteria, certainly I think we're well on the way, and we kind of, I would say we can be very confident that we will be able to meet those 6 criteria. But there are continued details in the preparation. For instance, you might say that we have good outbreak control capacity in continuing care. But there may be further details to get us to a really comfortable level that we have kind of all the criteria addressed to the degree of preparation where we could really be confident that that's in place. Similar, we're still, although we have, I would say, very good healthcare capacity right now in terms of maintaining the hospital at its current capacity. We also have some tweaks to make to that, and we want to look at various tiers of surge capacity within the system, including for rural. So I think it's a matter of continued planning to get us to that comfort level where at the same time we can start looking at, well, what would be the priorities for opening up? What are the categories? And that's really a collaborative exercise with Canada at the same time for establishing not just the criteria that make sense for us nationally and locally, but also the priorities for where we should be looking at opening up first and how.
We'll go next to Gord at the Yukon News.
Yes, just for some, see if there's clarification. Is there any other restriction on access to non-resident family members looking to come to the territory?
I don't know what you mean as far as any more than what we've announced today, or any more. Can you just be a little more clear with the question?
For sure. When I read this, it sounds like family members can come visit their relatives in the Yukon. Is that true, or are there any other guidelines these family members would have to follow?
Yeah, so again, the new border controls, they are very specific guidelines for Yukon family members who wish to travel to the territory and reside with Yukon residents during this public health emergency. So family members seeking to enter into the Yukon will require a letter or an email confirming that the Yukon resident and member of their extended family is expecting them to arrive. And again, this is about coming here to reside with family.
Okay. And I do have another question regarding to the daycares. I was wondering, is this something that was planned? Like, there was an announcement today about daycares now being open to only open to the critical or essential workers' children. Is this always going to be the plan?
So all announcements, again, to say it was part of a plan, we are taking the best information that we have on a really hour-to-hour, day-to-day basis, and so all of the messages, whether it be for education or daycares or for family members, I just ask everybody to pay attention to yukon.ca because it is a changing landscape. I myself, even in the position that I'm in, every morning and every evening I visit again yukon.ca to make sure that I'm up to date with any of the changes. To say it's part of a plan, I mean, again, our plan is to follow the advice of the medical community and to develop policies that reduce the curve and reduce the strain on our medical system while also keeping Yukoners as safe as possible.
To that, so that what Premier Silva says is correct, and in addition, there are still the mechanisms in place for children in need to be accommodated within daycare, and there is a process for verifying that.
And I will just also add, last week I forgot to thank the early childhood educational providers in the Yukon, and I'm sorry for that. And again, for all people working in daycare and with our children, thank you very, very much for all your continued work.
Okay. Sam, Yukon News? No, we'll move on then. Tim from CKRW?
Hi, I'm
Sorry, we'll go to Tim, then we'll come back.
John from the Yukon too.
Oh, John, sorry.
Yeah, my question is just a little bit of a clarification. For the purposes of the orders that are in place now, what is a family member? Are we talking immediate family, first cousins, second cousins? Like you mentioned that the people at the border are going to be the ones who are making these decisions. So can you sort of elaborate on how close you have to be in order to allow someone to live in your house?
Immediate family, for sure. And again, it's one of those things, what I've heard, I've had constituents of mine asking exactly these questions of my mom lives in the Yukon and she's elderly and I'm concerned for her health, then of course, come up. If this is one of those, well, I'm just coming up because I have a relative up and I just want it, no, that's not the reason. So, again, think critically, think about your reasons for being coming up, and really that's what it's about. If you're coming here to reside with family members, direct family members, absolutely. Again, you will have to self-isolate. You will still have to take in the mandatory requirements. But again, this is one of those things where if it was on your mind, it doesn't hurt to take a look at yukon.ca to see the revisions there, but also have that conversation. Contact an MLA, contact our government. We can definitely help provide information. But really, this is about direct family members coming up to support family members in the Yukon. This is not an opportunity to come up because you like the Yukon and it's nice out. This is more about we're in a pandemic and you have family members you're concerned about and you're directly related.
Do you have a follow-up question, John?
No, thanks.
Okay. Now we'll move to Tim from CKRW.
My question's for Dr. Hanley. Just can you give us an update on the activities at the Respiratory Assessment Center and maybe clarify those who maybe are getting back to the territory and hearing about the center? What are the parameters for going there? Can you walk in or do you have to be referred from a doctor or 811? Can you just clarify those activities?
Certainly, about access to the Respiratory Assessment Clinic or Center or the RAC, which is in Whitehorse. And what we encourage is a phone call first using the 811. And in fact, there's a kind of a phone tree through the 811 so that you would be directed to have a conversation about where to seek care if you have a respiratory illness, so a flu-like illness. If you have respiratory symptoms and think you might have COVID, or you just want to get checked, a medical checkup, then you would be directed to or advised to go to the RAC. The hours of the RAC would then be would be explained. It's 7 days a week, and I believe it's still 10 to 4 o'clock every day. So now, if you showed up, they're not going to turn you away, but we encourage that conversation first, just so that people are going to show up at the right time and know what to expect.
Do you have a follow-up, Tim?
Yes. Just how busy is the RAC? Do you have any numbers or anything?
Yeah, it's been, I don't have the exact numbers with me. It's been a kind of a handful a day lately, and that again reflects the lower levels of influenza illness and related respiratory viruses that we're seeing, as we often do at this time of year.
Thank you. We have time for 2 more questions. Is there anyone on the line who would like to ask a second question?
I haven't had a chance to ask a question yet, Pat. It's Jane from CBC.
Oh, Jane, I'm sorry. Please go ahead.
It's Jane from CBC. I haven't had a chance to ask a first question.
Go ahead, please, Jane.
So this is a question for Dr. Hanley, and it's something that both Dr. Hanley, you and Premier Silver alluded to. More people are outside. It's nice. It seemed like last week people were really following restrictions, and you would go to the grocery store and see people wearing face masks and keeping a distance. It seems like where there's no community spread, and today is the first day there's been a new case in over a week, it seems like people are feeling maybe comfortable and safe. How do you encourage people to keep following the guidelines and keep physical distancing when, you know, it seems like cases are slowing down here and it seems like we're somewhat safe?
It's a really good question. I was going to say the same thing, and I was hoping that this. I mean, it's interesting to be actually talking about a new case and at contemplating opening up at the same time in the same conversation. And this is the curious place that we are. So I would say that, as I said, I think this case is a reminder that COVID is ever present, and we should assume that it's present. We should assume that there are cases that are maybe similar to the one that we just learned of today, that is related to travel, and perhaps has been simmering for a while undetected, perhaps with very mild symptoms. So I think we should always act on the assumption that COVID is among us, and thus maintain the vigilance that we need to maintain. It's hard, and I know that it's not without costs. In combination with all of the other measures, significant and even great costs, but we know that it works. So I'd say let these occasional cases that we'll continue to see be reminders of the presence of COVID. I can't emphasize how dramatic the effect is on containing spread, that the people who have been affected so far have almost universally been observing self-isolation, that their families have been aware of symptoms and the need to get tested, the need to isolate. And it has literally helped to save us from COVID creeping out and spreading in the community. So where we remain in a really good place in this phase of containment, and I think we have a good chance of staying in this phase, but it's critical that we maintain these 6 fundamental measures of safety, of vigilance. Again, physical distancing, social isolation, or social isolation when you need to be isolated, self-isolation. I'm forgetting my terms. Self-isolation, staying away from others when you're sick, and the border restrictions, which are ever becoming more sophisticated, I would say, and tightened. and protecting our communities from unwanted visits. All of these are critical to maintaining the good position that we have.
I'll just add anecdotally to that. Great question, by the way, Jane. I had a conversation with one of my friend's kids the other day, and he asked me, when do I get to hang out with my friends again? And I might have been a little cruel in my answer, but I said to him, what you're doing now is really going to be helpful later, and it's going to make it sure that you can visit your friends quicker later. I said, imagine if it was Christmas Eve, and every time you peeked out of your door, got out of your bed and peeked out of your door to see if Santa was there. Imagine if just by doing that, Christmas was now going to be a week later. It would really make you be a little bit more diligent to your parents' recommendations, that's for sure. So that's where we are right now. I know everybody wants to get out and wants to hang out with their friends, but if we can adhere to the guidelines and the recommendations then that's the best thing that we can do right now to make sure that we all get to hang out with our friends sooner than later. And I wanted to also add as well to the question about, if you're coming up to support a family member, what we would urge you to do is to send an email out to covid19info@gov.yk.ca. That's the best way to explain your situation in an email before you get turned around at a border.
Jane, do you have another question?
I guess, how can people cope with kind of keeping up this stamina of keeping a distance and wearing a face mask and washing your hands? It's a lot to think about and process, I guess. Do you have any words of advice about keeping that kind of stamina going where we're also kind of trying to think about the future and maybe a new normal?
I'll just say that what I've been seeing on social media is, my goodness, Yukoners are resilient and adaptive. So people are finding ways of sticking with the strict recommendations and the guidelines and the requirements now, and also getting out on the land. Like it seems also, I'm seeing a lot of businesses that aren't necessarily essential services that are doing everything they need to do to stay open if they can, by being resilient and being creative in that approach. So I would just say keep watching on social media for best practices. There's I'm astounded every time I look to see how resilient and how smart Yukoners are to say, to be able to get out and enjoy some fresh air, but at the same time keep people safe. And I remember 3 weeks ago where we thought as the Yukon, it's hard to think about a flu as something else other than I don't want to get this condition. But now I see Yukoners going, I don't want to give off this condition. I don't want to be the person responsible for spread. And I'm just amazed at how, as a community, everybody that I see, everybody that I see are doing exactly that, and they're doing that in some extraordinary ways. Some of the arts community, I'll do a shout out to Sova and others, in Dawson, the designs that are making for masks, people are doing the best they can in this situation to be creative, to be resilient, and to reduce the spread. And I can't thank people enough for that.
Well said.
Okay. Is there anyone on the lines that I missed? We do have time for one more question if someone has something. Hearing nothing, thank you very much. Thank you, Premier Silver. Thank you, Dr. Hanley.
Thanks, Bob.